All right, welcome. Today, we're going to play detective. We're stepping right into a clinician's shoes to solve a really fascinating diagnostic puzzle. We've got a patient, some pretty concerning symptoms, and a clock that's been ticking for 3 long months. Let's dive in.
So, here's the case style. You've got a man with a headache and some vision problems, and they've been getting worse and worse over the last 3 months. I mean, right away, you know this isn't just a simple migraine, right? So, what's really going on here?
Okay, so in medicine, whenever you have a list of potential causes, it's called a differential diagnosis. But for our purposes, let's just think of it as lining up the suspects. We have four main possibilities, and it's our job to use the evidence to figure out which one is the real culprit. And here's our lineup. You've got two kinds of brain bleeds, a subdural and an epidural hematoma. Then there is a potential brain tumor, a cerebral neoplasm. And finally, a really serious infection, bacterial meningitis. Now, all of these are serious, for sure, but only one of them is going to fit the very specific facts of our case. You know, in any good mystery, there's always that one key piece of evidence that just cracks the whole case wide open. And in this situation, that critical clue, it's been hiding on plain sight this whole time. It is all about the timeline. Yep, that's it. The fact that this has been slowly progressing for 3 months. That is our single most important clue. This is the filter we need to look at every single one of our suspects through. So how exactly does this timeline help us solve the case? Okay, this really lays it all out for us, doesn't it? Look at how different these are. On one end, you have things that hit you like a ton of bricks, hard and fast. An epidural hematoma, that can develop in minutes. Bacterial meningitis, we're talking hours. A subdural hematoma might give you a little more time, hours to days. But then, look all the way at the other end of the spectrum. There's only one suspect on our list that fits a timeline of weeks to months. So, with that timeline burned into our brains, the picture becomes, well, incredibly clear, right? Three of our suspects just don't fit a 3-month story. So, it is time to unmask the one that does. And boom, there it is, a cerebral neoplasm. That slow, gradual worsening of symptoms over a period of months, that is the absolute classic signature of a growing tumor inside the brain. So what exactly is a cerebral neoplasm? Well, it's what doctors call a space-occupying lesion. Think about it. Your skull is basically a hard, fixed box. There's no extra room. So as a mass, like a tumor, starts to grow in there, it literally takes up space and starts putting pressure on the brain. And that pressure is exactly what leads to the kinds of symptoms our patient is having. I mean, look at this. The evidence is just a perfect match. Symptoms developing slowly over weeks to months? Check. They get progressively worse as the mass gets bigger? Check. And the classic signs our patient had, the headache and the vision problems, that's textbook. It all just fits together perfectly. And you know, it's interesting. Sometimes the only thing you might see at first is a brand new seizure, completely out of the blue. All right, so now that we're pretty confident we've got our culprit, let's do our due diligence. Let's quickly go back and check the alibis for our other suspects. You're about to see why they were never really a good fit, all thanks to that one key clue, the timeline. Okay, first up, the subdural hematoma. You can see right away the onset is hours to days, not months. And on top of that, it's usually tied to some kind of head trauma, which wasn't even mentioned in our patient's story. The timeline is just way off. So suspect A is officially cleared. Next up, the epidural hematoma. Wow, this one is even more dramatic. We're talking minutes to hours, and it causes a super rapid decline. This is a 5-alarm medical emergency, which is the complete opposite of a slow 3-month progression. So yeah, suspect C is definitely not our guy. And last but not least, bacterial meningitis. This is an acute infection that hits like a freight train, usually within hours. Plus, it brings along its own distinct calling cards, like a high fever and a stiff neck, symptoms our patient didn't have. So the timeline and the symptom profile, they just don't line up at all. Suspect D is also cleared. So we've gone through our investigation, we've identified our culprit, we've checked the alibis. So what's the big takeaway here? What's the key lesson from this whole case that you can actually use in the real world? Here it is. This is the clinical pearl you want to put in your pocket. A months-long progression of a headache plus visual changes, that should always make you suspicious of a space-occupying lesion inside the skull, especially when there are no signs of trauma or infection. That is the crucial thing to remember. And you know, that brings us to one last thought. In this whole mystery, Time was the invisible clue that solved everything. It really makes you wonder, doesn't it? In the incredibly complex art of diagnosis, what other subtle clues, hidden right there in a patient's story, are the ones that we most often overlook?